Continuing on discussing cancer, moving on from normal human cells to cancer cells. When we are discussing cancer cells, we oftentimes categorize them in these two categories, benign versus malignant. Benign cancer cells or tumor cells essentially mean they're harmless, they're not appropriate normal human cells because maybe they're not following all of those rules of replication, but usually it's not that big of a problem. They're not usually going to require intervention unless they're bothering someone. You know, maybe it's a cosmetic issue, maybe it's causing difficulty with vision if it's something near their eye, but nothing that's going to potentially cause real harm or death. Whereas a malignant cell growth is indicating cancer. This is serious and can potentially lead to death without intervention. Here's some information about benign tumor cells. Wrong cells growing in the wrong place or at the wrong time, potentially just the wrong size, maybe more of them than they need to be. Like we discussed, it's a problem with cellular regulation. It might not be a big problem, but it's enough that maybe we have a little bit of overgrowth of some benign cells. Some examples of benign tumor cells are moles or nevus, uterine fibroid tumors, skin tags, endometriosis, and nasal polyps. So you can see by these examples, they can cause some problems, but they're never really going to be fatal issues. Skin tags, some people don't like cosmetically. Endometriosis can cause some significant problems for women, but generally does not turn to cancer. Some of the features of benign tumors are shown on this slide. So you'll see that there are a lot of features to benign tumors that are very similar to those of normal human cells. They have a specific morphology. They look like the tissue that they came from. It's not like they're odd looking or inappropriate looking. They look, if it's a skin tag, it looks like a skin cell. Just like a normal human cell, they have a small nuclear to cytoplasmic ratio. They have specific differentiated functions. They continue to perform just like their normal cell. For example, in endometriosis, the endometrial tumors respond exactly as they would to levels of female hormones. So when the woman is menstruating, the endometrial tumors or endometrial lining, even if it's these endometriosis tumors, will still slough off. So they respond in the same way that a normal cell will. So they have specific differentiated functions. They have tight adherence, just like a normal human cell. They're going to stick to their friends because of that fibronectin. And because of that, they don't move around. So even though their growth is not needed, it's not necessary, it doesn't help any specific function in the body, it's still orderly. So there's some problem with regulation of the growth, but it usually is growing by hyperplastic expansion. And the picture of that is in your last lecture, where hyperplastic expansion is essentially a larger size, but the cells are the same size. So a larger volume of cells because maybe there's a larger number of cells, but the cells themselves aren't big. And then we also see normal chromosomes in most benign tumors. Moving on to cancer or malignant cells, this is where we start seeing differences. These cells are abnormal, they serve no useful function, and they are potentially harmful to body tissues. So comparison to normal body cells with the malignant cells, we've got anaplasia, which is the loss of appearance of the parent cell. So a cancer cell, a malignant cell, bears no resemblance to its parent cell. Size, shape, morphology are all different from the parent cell. You can't take a malignant cell and say, oh, this looks just like the skin cell it came from. They don't look like it. There's a large nuclear to cytoplasmic ratio, so there's a larger nucleus than a normal human cell or a benign cell. Specific functions are totally lost in malignant cells. They don't serve any purpose. Malignant cells don't make fibronectin, so these cells easily break from the main tumor and cause significant issues because of the migration or the metastasis. So migration occurs because they don't bind tightly together and it is allowed to spread or metastasize, and this is what makes it so deadly. Also, cancer cells, think about it like they don't know boundaries. They don't understand personal space. There's no contact inhibition for these guys. They don't care if another cell is touching them. They're just going to keep dividing. So they just keep growing, and that moves us on to the rapid or continuous cell division, continuously re-entering the cell division stage, and it doesn't respond to signals that cue apoptosis. It just keeps dividing. We also see in malignant cells aneuploidy, or inappropriate chromosomal number. As a cell becomes more malignant and gets further and further away from its original parent cell in terms of anaplasia, we are also going to see chromosomes lost, gained, broken, rearranged, just generally changed DNA material.